My name is Jody. I'm 42 years old, and I'm BRCA1 positive. Once you become a parent, you sort of lose a little bit of your identity. Suddenly you're not yourself anymore. You're your child's mother. I have one child. His name is Henry, and my favorite thing is to be Henry's mom. Henry was only 7 years old when his dad died. His dad had gotten sick when I was pregnant with Henry, so Henry really only ever knew a sick dad. So it was a long process, not always sad, but long process of losing his dad from the time he was born. 5 years after his dad, my husband Alan, died, my mom died of ovarian cancer, and she fought that awful disease for 8 years. After watching my husband die and my mother die, I sort of became aware of my own mortality and sort of afraid of leaving Henry. And even before my mom died, I had read online and anything I could get my hands on about genetic testing, because it just seemed unreasonable that I couldn't figure out where this came from. My mom was only 48 when she was diagnosed. So I knew that BRCA testing existed even before she died. So I started asking my doctor every time I went, and I went a lot because I had some, benign problems, but I went to the doctor a lot, and I kept asking her, hey, what about that test? And she kept telling me, stop worrying about it. You're healthy, you're young, stop worrying about it. But every time I went back, I said, I really want to be tested. I just couldn't bear the thought of leaving Henry or putting him through the illness of another parent. So I kept asking, and finally she just said, look, move on with your life. And so I did. I got married again. I met Jason, and I got married again in 2007, and Henry was 12, and he gave me away at our wedding. It was amazing. But I still had that nagging question. So ironically, I started having allergies. So in 2008, I went to my husband's family practice doctor. And I'm put into the waiting area, the little patient room, and waiting for the doctor to come in. And I noticed there's a poster on the wall for BRCA analysis. So the medical assistant comes in, and I said, hey, I've been trying to get this test for 7 years. Can I get it today? And she said, sure. So I signed a consent form, rolled up my sleeve, they took my blood, texted my husband and said, hey, I'm gonna have this test. He said, sure, because I was gonna have the test. I wanted to know. They took my blood, I signed a consent, I went away. 3 weeks later, 2 days before my 39th birthday, I was walking out the door to go to Dallas. My son was running a marathon. I'm positive. I was just sort of in a stunned sense of panic, and I didn't know what to do. We went out of town, it was the weekend, we came back, and I started looking for doctors. That family practice doctor referred me to 2 oncologists. I called both of them. Neither one of them would see me because I didn't have cancer. Back to the drawing board. I started trying to find a doctor to see me, trying to figure out what to do. I knew that I was going to have everything taken out that needed to be taken out. I had already made that decision. I was not going to die of ovarian cancer if I had a choice. I was not going to put Henry and my new husband through this. So I was just desperate, calling every doctor in the phone, not in the phone book, but literally on the online phone book. And so finally, in a moment of desperation, Jason, my husband, flipped over my test result, found the 800 number for Myriad, and called the hotline. He got a genetic counselor who got on the phone with me and gave me the names of doctors in Austin who were well-versed in BRCA patients, but more importantly to me, gave me the name of someone who was trying to organize this flailing support group for hereditary cancer in Austin. So I called that woman, and she told me they were trying to get together a meeting the first Saturday in January at Central Market. It's an outdoor patio at a grocery store in Austin. And I said, well, how will I know how to find you? And she said, well, look for the pink balloon. So I knew this was going to be a bunch of breast and ovarian cancer patients, which probably meant all women, but I made poor Jason go with me. And so we get to this outdoor market, and there's 1,000 people there, and there are no balloons. And so I'm walking around looking for this pink balloon, and I can't find it. So I'm getting more and more nervous. And then I see a woman sitting by herself, and as soon as we made eye contact, I knew that she's who I was looking for. And she, along with some other women in that support group, showed me how to get through this, how to even start on my journey to get through this. They gave me names of doctors, they gave me names of genetic counselors, and they just told me what I needed to know, that I was going to be okay and that this was not the end of the world and that I had a path. Through them I found doctors to do my surgeries. So this was the first weekend in January. January 20th, I had my complete hysterectomy and my ovaries removed. And April 2009, I had my bilateral prophylactic mastectomy and reconstruction. It took me 7 years to get the test, but it took me fewer than 4 months to have all of my prophylactic surgeries. And I'm fine. I learned through the loss of my husband and the loss of my mother and through this journey not to take time for granted. So I tell my story every chance I get. If you're sitting next to me on the bus, you're probably gonna have to hear about my story. Because everybody we know knows somebody who's been through breast cancer or who's had that diagnosis. And you know, more and more often I'm finding people who know someone or have a relative with ovarian cancer. And maybe it's not hereditary, but maybe it is. And they need to know that they have the option of pursuing that, knowing their family history and talking about it with their physician, because everybody has the right to know. And this test changed my life. I'm not afraid anymore. And yeah, the surgeries weren't fun, but I didn't have to go through the cancer diagnosis. And I want to prevent that for as many people as I possibly can. Strangers, fine. What if I change your life? What if my story prompts you to ask your doctor about being tested? So I tell it every chance I get, because I feel like I got this second chance to be Henry's mom for a very long time.